How do NSAIDs affect diverticular disease? Imagine taking a medication to ease your pain, but it might be making a hidden condition worse. That's what happens with non-steroidal anti-inflammatory drugs, or NSAIDs, when it comes to diverticular disease. These drugs are common for headaches, muscle aches, and other pains, but they can have unintended effects on your colon. Diverticular disease involves small pouches called diverticula forming in the wall of the colon. While many people have these pouches without symptoms, complications like diverticulitis or bleeding can occur. Research shows that regular use of NSAIDs can increase the risk of these complications. In fact, people who take NSAIDs regularly are about 1.5 to nearly twice as likely to develop diverticulitis compared to those who do not. The risk is even higher for more severe cases, such as when abscesses or perforations happen. NSAIDs work by blocking substances called prostaglandins, which help protect the lining of your stomach and intestines. When prostaglandin production is reduced, the mucosal lining of the colon becomes more vulnerable. This can lead to increased inflammation around the diverticula, making them more prone to infection and rupture. Additionally, NSAIDs can impair blood flow in the colon, which hampers healing and increases the chance of bleeding from these small pouches. Because of these effects, healthcare providers often advise patients with diverticular disease to avoid NSAIDs, especially during flare-ups of diverticulitis. Instead, they may recommend acetaminophen for pain relief, which does not interfere with prostaglandin production and is gentler on the colon. If you have diverticulitis, it's important to follow your doctor's advice and avoid NSAIDs unless they specifically say it's safe. In summary, NSAIDs can negatively impact diverticular disease by increasing the risk of inflammation, bleeding, and even perforation of the colon's diverticula. Being aware of this risk helps patients and doctors make safer choices for managing pain and preventing complications. Always consult your healthcare professional for personalized advice, especially if you have a history of diverticular issues.